I'm going to be getting a deep ProFractional laser for full face. Will it affect the fat transfer I had done with my facelift?
Thank you for your question. You're asking a question that you are planning to get a deep profractional laser treatment, full face, and you're asking, will it affect the fat transfer that you had with your facelift? Well, I can give you some understanding of the interaction of the lasers and the skin relative to what you had in terms of grafting, but it may be difficult to be as specific as you'd like. To give you a little background, I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been practicing in Manhattan and Long Island for over 20 years, and I have a lot of experience with lasers since using the original CO2 lasers back in the mid-90s, as then switching to erbium laser, ablative erbium laser, for many years, and then coming back to fractional CO2 laser. And what I think is a challenge for a non-physician and someone who's not even familiar with the brand names of these lasers is the term fractional is getting confusing. And one thing, there's a couple of concepts to understand to differentiate erbium and CO2 laser. And so to begin with, the erbium laser is a laser that generates, it causes ablation, but it doesn't generate as much heat to the deeper area of the skin, which causes tightening of the backbone of the skin called the dermis. Now, what the ProFractional laser is an erbium laser. So that's one factor that might be to your advantage in terms of affecting potentially what's going on under the skin. Now, hopefully your doctor was able to explain that to you, because a lot of times people think that they're getting a fractional CO2 laser, and a fractional CO2 laser penetrates deeper. And deeper doesn't always mean better, but it just means that there is more thermal energy delivery to the deeper layers of the skin that can cause some skin tightening. So you have to also understand what's your desired outcome. When I did full face erbium laser, I would say that it appeared that the skin was a little bit tighter, but it was more about resurfacing and getting a smoother quality skin. Now, when you think of fat grafting, fat is grafted below the skin, and if the fat has already healed, then it's not likely that it will have a direct effect on the fat under the skin. With that being understood, and it depends on the timeline since you've had your facelift and fat grafting procedure. A lot of times when fat grafting is done, it's not done in exactly the same area as the flap of the facelift, but rather in areas which haven't been undermined, because you need a very good stable blood supply. So chances are it's not going to be an issue at all. People who've had a facelift, whether it's at the time of the facelift procedure or even after, it's always important to communicate that with the doctor if it's a different doctor performing the resurfacing procedure, to understand the timeline since the procedure, because it is a trauma. Laser is a trauma to the skin. And I always explain to patients that there's a certain amount of limit on whether it's heat energy or resurfacing, abrasion, whatever it is that the skin can tolerate. In our practice, we advocate very strongly regenerative technologies such as the use of platelet-rich plasma and acellular matrix to help rejuvenate skin without doing too aggressive ablation. This is on the, from so much experience that I have in what happens to skin long term after aggressive laser treatment. Now, that's in no way am I contradicting what your doctor is recommending, but in terms of the integrity of the fat that was placed under your skin, it's not likely to be a problem. Sometimes when there's skin inflammation, that can be a problem. If there's an infection, that can be a problem. But as long as you and your doctor have a good sense of communication about what to expect, and if you're basically using an erbium laser to resurface the skin, what you should see is an improvement in fine lines. You should see an improvement in discolorations, but you should also not have a prolonged amount of redness from a lot of thermal energy being delivered into the skin. So I would advise, again, clarify this with your doctor, the individual who's actually going to do your procedure. And if you were trusting this doctor to take off all the top layers of skin on your face, then I think that you should probably have enough trust in the quality of their knowledge about that they'll convey to you about the safety to the fat grafting that you had under your skin. So I hope that was helpful. I wish you the best of luck, and thank you for your question.